Substance Use Prevention Programs in Early Childhood Education by Alice Calco. My project addresses a local substance abuse coalition that would help to arrange lesson plans, acquire funding, and gather information to be distributed within the community. The ultimate goal of my research is to bring awareness to early childhood prevention education and mental health education in elementary schools. I'm interested in this topic because I study chemical dependency counseling. I would like to be a school counselor. I think elementary schools are pivotal periods of time in children's lives, leading into adolescence when things get much more complicated for children. Chemical dependency is an ever-evolving field. There are no definitive answers, but there is a lot of evidence-based practices. Adolescence has been the main focus of substance use prevention for a long time. Currently, elementary schools lack adequate mental health awareness. I think teachers are part of the problem of underserved schools because I think we make it too hard for teachers to continue their education. Lack of funding is the main problem with continuing mental health education for faculty. There aren't enough programs that schools can afford or have easy access to in order to build an early childhood education prevention program. In this presentation, we will talk about what is early childhood substance prevention programs, the advantages to early introduction to substance use prevention, as well as current substance use prevention programs that are used in elementary schools. Substance use prevention programs are often introduced in adolescence, middle school, and high school, but is this early enough for intervention? Early childhood education prevention initiatives focus on giving children in elementary schools the tools to make healthy choices, prolong first use, and exhibit healthy social emotional skills. Educating teachers in mental health and prevention programs helps to aid children to avoid substance use disorders later in life. In talking about what early childhood substance prevention programs are, we need to first discuss the theories of addiction, protective and risk factors, as well as what are the goals for early childhood prevention. Substance use theories have drastically changed in the United States over generations. Historically, substance use disorders were seen as a fault of a person's moral character. People were thought to be deviant addicts by choice. Currently, the biopsychosocial model is commonly used in chemical dependency practice. The biopsychosocial model is a multidimensional approach that addresses many factors influencing a person's substance use disorder, including biological, psychological, and social factors. Risk factors are factors that increase a person's likelihood to develop a substance use disorder. Children grow up with many risk and protective factors. Some risk factors include domestic violence, trauma, easy access to substances, and exposure to substances. Protective factors are factors that decrease a person's likelihood to develop a substance use disorder. Protective factors can be learned as well as environmental. Environmental programs, such as programs that aid the surrounding community, are protective factors. Goals of prevention programs in early childhood education focus on protective factors such as age of first use, social emotional skills, and resiliency. Prevention in early childhood education is different from prevention in adolescence. Prevention programs in adolescence focuses on information about substances and historically has used scare tactics as a way to deter teens from using substances. In elementary schools, prevention programs focus on teaching children life skills such as coping skills, self-regulation, and productive communication. The goal of early childhood prevention education is to give children self-confidence and self-discipline to make healthy choices going into adolescence. Study called Monitoring the Future National Survey Results on Drug Use from 1975 to 2022 include first use of various substances from students in the United States. In 2022, alcohol was reported as the most initially used substance starting from fourth grade or below, reported by eighth graders. Various surveys reported through the Monitoring the Future surveys commonly report the same findings, that alcohol is the first substance of use. Advantages to early introduction to substance use prevention acts to increase the age of first use, teaching children social emotional skills that they can take with them into adolescence and increase resiliency to substances and peer pressure. Age of onset is the age at which a person first uses a substance. Postponing first use may be a crucial factor in decreasing substance abuse disorders in adults. The longer a person abstains from first use, their vulnerability to substance use disorders decreases. First use of alcohol at ages 11 through 14 greatly heightens the risk of progression to the development of alcohol disorders and therefore is a reasonable target for intervention strategies. The odds of dependence decreased by 14% with each increasing year of age at onset of use, and the odds of abuse decreased by 8%. Prevention in early childhood education focuses on skills such as coping skills, self-regulation, and productive communication. Implementing social-emotional learning programs in schools, identifying low school readiness and deficits in self-regulation acts as protective factors. Prevention programs also aim to increase social-emotional learning, such that includes learning to handle stress, manage emotions, and tackle everyday challenges. According to Rethinking Substance Use Prevention, an earlier and broader approach, resilience, which is the ability to respond to life's challenges in a healthy and productive way, is critical at every stage of human development. Instilling resilience in these children early in life helps equip them to face challenges that would otherwise interfere with and compromise their development. Early childhood intervention focuses on bolstering resilience and self-regulation, mitigating risks that are likely to have beneficial effects on a child's substance-related attitudes and behaviors as they grow older. Children with increased risk factors are at heightened risk for school failure, are more likely to be excluded from pro-social peer groups, and to associate with deviant groups that prompt substance use. A foundation upon which future adaptive skills and experiences are built. Who is the ideal facilitator for early childhood education prevention programs? Should a police officer, a mental health counselor, or a teacher facilitate programs about self-regulation and resiliency? A police officer would seem to be an ideal candidate to facilitate a prevention program, but oftentimes children who have had the most risk factors for substance use disorders have had negative interactions with police and therefore find police officers to be intimidating. Trained counselors are also a great alternative to facilitate a prevention program. Generally, counselors lack the regular exposure to children, meaning they would not recognize the children in most need. Teachers are the ideal facilitators for prevention programs. Teachers offer a unique perspective on prevention programs because they have the most exposure to children on a regular basis, meaning that teachers would be the most likely to recognize children with the most risk factors. Teachers are also a trusted source of information for the children. Training teachers to facilitate prevention programs is difficult. Oftentimes, school faculty lacks the time or money needed for adequate training. In some of the examples given, the training is costly, time-consuming, or the teachers would have to educate themselves on their own. Some examples of currently used substance prevention programs in elementary schools include Project Aware, training modules for self-education, and the Good Behavior Game. These are broad representations of currently used programs. Some of these examples, like the training modules, represent a large category of programs, but it's a resource for teachers to self-educate. Project Aware stands for Advancing Wellness and Resiliency in Education. It develops a sustainable infrastructure for school-based mental health programs and services. It's a government-funded grant given to grantees to implement mental health-related promotion, awareness, prevention, intervention, and resilience activities to ensure that school-aged youth have access and are connected to the appropriate effective behavioral health services. The University of Maryland Behavioral Health Online Training provides training to individuals interested in supporting the behavioral health of youth and their families. This category represents a large number of programs. It is a great resource for teachers to self-educate in various mental health programs. The database is searchable and contains many grade levels as well. In Texas, the Texas Education Agency requires teachers to receive 150 hours of continuing professional education credits every 5 years. This is a way to keep teachers learning. If prevention programs can be incentivized to meet these continuing professional education credits, it would be a way to incentivize teachers to self-educate instead of bringing in costly additional prevention resources into the school. One of the modules that are represented in this example is the Supporting Social Emotional Wellness in Early Childhood. It focuses on ages 0 to 5 and promoting social emotional development in young children. The Good Behavior Game is a classroom-centered, universal, preventative intervention approach that can be thought of as positive peer pressure. In this game, the children decide the rules for good behavior. Beforehand, when the tasks start, each table that violates a rule gets what's called a spleem. When the game is over, the children talk about what the violations were and why they got spleems. After the game, the children get to pick one violation to do, for example, going under the table, and all the children then get to go under the tables. Unfortunately, for programs like the Good Behavior Game, teachers will need to seek resources on their own, or schools will have to budget for outside training. The main elements of research that went into my paper were primarily the paper called Rethinking Substance Use Prevention, an Earlier and Broader Approach. This paper is a very well-written report advocating for earlier substance use prevention intervention during childhood instead of waiting until adolescence. The report focuses on the advantages on early childhood substance use prevention programs. My resources were vast for this project, but a few other notable mentions would include the National Institute of Drug Abuse and the Substance Abuse Mental Health Services Administration, and the Hopkins Bloomberg Public Health magazine about the Good Behavior Game. The Good Behavior Game is an evidence-backed program that has seen promising results in early childhood education. Unfortunately, for many of these types of programs, training is the biggest problem for facilitators. The Good Behavior Game, although it is not complete training, it did a great job of offering accessible resources. Having teachers act as prevention program facilitators has many challenges. Resources in schools are usually limited, and teachers have a lot of work without additional training modules. Incentivizing prevention training programs would be the ideal transformation. Continuing professional education credits is a great example of government pressure for teachers to continue education. Prevention program modules that meet these CPE credit requirements would be helpful. Project Aware is also a great example of how to get government funding to bring additional prevention resources into school. Ideally, we need more government funding for prevention programs.